My name is Levi Gershkowitz. I'm the founder and CEO of Living in the Light. Living in the Light was started back in 2012 as a patient advocacy initiative, doing storytelling, photography, and really looking at the stories of people living with rare diseases as people instead of as patients. So with our experience over the years of working in over 60 different rare disease spaces with a lot of different partners, in the biotech space, and having so many close friends now who are both patient advocates and individuals living with rare diseases, it was apparent to me and the rest of my team very early on when we registered the impact of COVID-19 that a lot of families and individuals that we worked with were going to have some pretty significant needs. So I would say the end of, by mid-March, right, we were canceling our visits to families in different parts of the United States. We had a few families that we were scheduled to see, canceled those trips, and by the end of March, decided to start Istayhomeforrare, which is a campaign and a fund putting together relief funds essentially for families and individuals that were struggling and very much still are struggling financially. So we launched the campaign Istayhomeforrare.org on April 7th. And at that time, our initial goal was to raise $50,000. Now, almost 2 months in, we've raised $54,000, and we've set our goal at $100,000. In that time, there's been a couple other campaigns that have started from other advocacy organizations, which is terrific. So we're seeing a trend in relief aid. But one thing that's really significant about Istayhomeforrare is that right now we have the entire Living in the Light staff focused on this full time. And myself, as well as the executive director of CureCMD, are volunteering our time on this. So we have very minimal overhead and we're moving really quickly. So far in the first several weeks, we were able to get grants to 47 families throughout the US. And this coming week, we have grants going out to 20 new families. And the grants are in amounts of between $500 and $2,500. And that's actually based on the specifics of the application. So to give some information about how to apply, I mean, it's fairly simple in terms of just visiting the website if you have access, istayhomeforrare.org/apply, or just go to istayhomeforrare.org and you'll be able to find the apply button. And the application is right there. It asks for basic information around the treatment protocol of the individual, be it a child or adult, how the treatment protocol and regimen has changed of recent months due to COVID-19. For example, if there's some type of therapy, occupational therapy, physical therapy that's no longer available. And then for information relative to the household or the individual's income, how that's been affected. We know that a lot of people are on Social Security or disability, and that because of COVID-19, a lot of the Social Security checks have been really delayed. We've met some families that haven't been receiving their normal forms of financial support, and so they're at further loss. And we've met a lot of families that are out of work, people who have either lost their jobs due to this or are not able to take the risks of working their jobs because of the added risk that poses to their child or loved one. I can share a couple examples of some of the situations that we've been able to help people through. We've been able to help a family who could not pay their rent and was living in a motel basically get back into their apartment. We've helped a family that wasn't able to get their car on the road safely and needed to transport their child to a neurologist who they need to see in person, able to fix their car and safely without needing to use public transportation. get to necessary medical appointments. We've helped a lot of families with medical copays and cost of experimental medications, things that aren't covered by insurance. But actually the primary use is the basic necessities. It is paying for utilities, helping families keep their electricity on. We've had a few folks that had lost use of some of the utilities in their homes, and paying rent or mortgage, and food costs. So the grants come in the form of a Visa card that is preloaded, and so there's no tax liability for people receiving this, which was something we wanted to do that was really important, because again, we didn't want to create additional tax liabilities for anybody receiving these funds. So they receive them by the mail. And it also is very important to mention that we are not doing this alone. We are partnered with 15 other patient advocacy organizations, and that's how we've been able to get the word out to individuals and families throughout the United States that we're working with PAOs to make sure that their patient communities are aware that this grant is available. So it's something that is incredibly meaningful to us, and also it's heartbreaking, but so in a sobering way. We are currently trying to support some individuals who actually have passed away over the past couple months and help their families pay for funeral costs, and or people that are transitioning into end-of-life care and are having insurance issues. There's all different components that we're able to support people through. And I think what's most important is that if right now you are at home or have a house, roof over your head, you're eating your meals, knowing that a lot of people still are not able to work, but if you're in a place where you have anything that feels like safety or security, to recognize that there are folks who are not in that place, and even donations of $5 or $25 are incredibly helpful.